With me is Dr. Helen Colen, a plastic and reconstructive surgeon from New York, who specializes not only in the face but in the rest of the body as well. What are the most frequent kinds of surgery people ask you for in terms of their body?
Well, there's been a tremendous interest in liposuction, or liposuction as some people call it, and that's basically suctioning of fat from bulges, unwanted bulges of the body. Women usually request the thighs, the medial knees, now that the skirts are going up, and men usually request the abdomens or the stomachs and the hips or the love handles. And the surgery has become the most popular surgery at this time, and that's because the scars are non-existent. You make a little incision in the skin, and you put in a catheter such as this, a cannula. This is a big one. I brought it so that you can see it better.
That's not a giant hypodermic needle. That's more like a vacuum.
And usually it's about half the size, and you put it through that little incision, this type of a cannula. You attach it to a suction catheter, and you literally suction the fat out.
Well, let's take a look at some pictures of some before and after. How about this photograph
I have one picture that on the left you can see a lady beforehand and not right after, about 2 months after the surgery, where the thighs were reduced medially or inside the thighs and on the outside of the thighs, and the hips. And basically what happens is that there is a patient after the surgery. It's an ambulatory surgery. Come in the morning, go home the same day. You then wear a girdle for a week. And
that's important, isn't it?
Very important to wear a girdle to minimize the swelling and fluid collection underneath. And you put in each one of these little incisions, you put 1 stitch of a melting suture, so you don't have to remove it. I usually see the patient 1 week later, remove the girdle, examine the patient, they wear the girdle 1 more week, and then they're on their way.
Let's be a little graphic for a moment. In that photograph we saw a before and after, but the skin texture looked exactly the same.
That's correct.
During that week it doesn't look exactly that way, does it?
No. During that week I hate to look at it.
If we look at that screen, what would we see right after surgery?
Right after surgery, if you took the girdle off, you'll see bruising. It will be black and blue. It would be yellowish in some spots. It's usually not painful. People say they feel like they've been riding a horse.
You're not going to wear a bikini the next day.
You will not wear a bikini, and you will not be allowed to wear a bikini. But in any case, there's some swelling, there's some bogginess, and therefore you wear the girdle.
2 common questions people ask. Cellulite. Does this take care of cellulite?
Not really. If someone has let me just come to this picture. This is another picture of someone who had loose abdomen, but in this particular patient, we did an abdominoplasty, which is removal of the skin and the fat.
What would cause a loose abdomen like that?
Children, tremendous gain in weight and then loss. People who have very poor skin tone may have stretch marks naturally and have a poor skin tone all over their body. So then when you do an abdominoplasty, going back to the cellulite that you asked me before.
Or the dimpling that people see on the bottom of their butt.
Very often you don't remove the cellulite. This is not for cellulite. This is for accumulation of fat, which are bulges. It is sculpturing technique of the bulges of the body. It is not for weight reduction, and that you don't lose pounds. You may lose 1 inch or 2, but not pounds. And this is not to remove and smooth out your skin.
Does the fat come back?
No, the fat does not come back.
Using, Dr. Colen, this device under this chin?
Right, but this is a big
it is
catheter,
big.
And that's usually for the body. For the face, you use a very, very small one, and you make a little, you introduce it right under the chin, so you really don't see the incision. And then from there, you can suck out the neck.
Okay.
I'm calling about the liposuction, and Dr. Colen didn't talk about it as far as the ankles were concerned, and I did have that done, and I have not had good results. I've had it done over 4 times. Also, I had my abdomen done and my thighs, and the feeling was like a Novocaine feeling for about 1.5 years on the thighs and the abdomen, a very, very strange feeling. But my main concern are the ankles. That's what took me in there in the first place. I had heavy ankles. and now I have a whole set of different problems. First of all, it was heavy ankles, and now it's like lumpy. He went way too far up on the calf. And I was wondering, he tells me the ankles are the hardest part to do, and I wish I had known that when I went in for consultation. I might not have had it done.
Dr. Colen, are they and why?
Yes, I try to stay away from ankles. It's very, very important before you do liposuction to examine the patient and see, number one, what is their lymphatic circulation.
Lymphatic is the drainage.
The drainage from, because this is the lowest part in the body, the gravity pull is the hardest, and the circulation will probably be the poorest. So you have to see whether indeed you have just heavy muscle in the ankle or a lot of fat. Usually it's a muscle heaviness, not fat, and suction will not help it. More or less what it will do, it will make the ankles more heavy, more lumpy, and they don't look any different. They may look worse.
How about the Novocaine feeling?
That is unusual. I'm not sure how it was done or what. Usually patients have return of any feeling 2 or 3 weeks later, and I have myself had not had that type of a complaint that lasted for that long.
More on reconstructive and plastic surgery on the Nancy Merrill Show in a moment.
Hello?
Yes.
My concern is I'm still of childbearing age, and I would like to have a stomach tuck. I have scarring from a previous surgery. It's kind of bad scarring, and I have stretch marks and additional skin.
That's a very common question, stretch marks.
Right. Question, is she after childbearing age?
Yes.
No.
This is after a baby, though, isn't it?
Yes, I've had 2 children.
Yes.
If you are planning to have any more children or any more pregnancies, wait. If you have finished with the family, having family, at that point you could have an abdominoplasty. That involves removing the excess skin, which usually involves the stretch marks. So the stretch marks usually occur between the belly button and below. So you remove that whole segment of skin with the fat underneath it, and you do what's called an abdominoplasty. And that's a very, very common procedure in women who have had multiple pregnancies.
Removing, you're talking about actually cutting out the skin, that portion of the skin.
You actually cut out the skin, and you bring the skin from above the belly button down, and the scar is usually hidden right above the pubis.
Someone comes into you and you feel quite strongly they should not have reconstructive surgery. What do you recommend?
First, I speak with them, and if someone still wants to have some children, I would definitely be against it because it will just recur. And it's, you know, unless someone wants to go through the surgery twice, I would recommend to wait. If someone is not a good candidate, they might be bad diabetics, they might be a smoker of cigarettes, which, you know, is not a good thing to be if you undergo any type of elective surgery. If they have high blood pressure, heart disease, I will advise against it. Or if they really are not a candidate, you can't really do anything to make them better. I mean, this is what it is. You will discourage it of it.
You'll discourage it and give them that information.